What is dual diagnosis? Someone diagnosed with both a mental illness and a substance use disorder is known to have a dual diagnosis. Also known as a co-occurring disorder, a dual diagnosis must be treated using specialized therapy that addresses both disorders simultaneously. Otherwise, the person can relapse back to the drug and alcohol use and may never learn how to manage or recover from one or both disorders. Dual diagnosis is highly common and affects an estimated 50% of people with a mental illness and 50% of all people with a substance use disorder. Symptoms of any mental illness can be difficult to cope with, especially for someone who isn't receiving any form of treatment. Many individuals with mental illnesses may try using drugs and alcohol as a form of self-medication to reduce their symptoms and try to feel better. Unfortunately, drugs and alcohol are usually only short-term solutions for mental illness and can make symptoms worse over time. On the flip side, drug and alcohol addiction can increase a person's risk of developing a mental illness. Chronic use of drugs and alcohol can lead to changes in your brain chemistry and alter levels of important chemicals like serotonin and dopamine that play a role in your mood. After a period of heavy drug and alcohol use, you may lose pleasure in normal activities and suffer anxiety and depression as a result. Certain types of illicit drugs like methamphetamine can even trigger paranoia and psychotic behavior that requires hospitalization to prevent violence, suicide, and homicide.